Hello everyone! Welcome back to my channel, English Waves. I'm Anna. 2 months ago, I woke up with terrible pain in my stomach. I knew I needed to see a doctor. But when I called the clinic, they asked, "What are your symptoms?" And my mind went blank. Symptoms? How do I describe pain in English? Is it hurt, ache, pain? And when the doctor asked, on a scale of 1 to 10, how bad is the pain? I wasn't sure how to answer. That experience taught me something important. Health vocabulary is not optional. When you're sick or injured, you must be able to explain what's wrong. This isn't just casual conversation. This is about your health, your safety, maybe even your life. You need to communicate clearly with doctors, nurses, and pharmacists. Today, we're learning essential health and medical vocabulary, from common symptoms to going to the doctor, from the pharmacy to emergencies. And to help me today, my co-host Ben is here. Ben, have you ever been sick in an English-speaking country?
Yes, last year I had a terrible headache and had to go to the emergency room.
Oh no, that must have been scary.
It was, but knowing the right vocabulary helped me get the help I needed.
Today, we'll make sure everyone can do the same.
This is important, everyone. Let's learn together.
Here we go. Let's start with the most common symptoms, how to describe what's wrong.
First, what's the difference between hurt, ache, and pain?
Great question. Hurt is a verb. My leg hurts. Ache and pain are nouns. I have an ache or I have pain.
Ache is usually dull and continuous. Pain can be sharp or dull.
I have a headache. I have a stomach ache. I have back pain.
My throat hurts. My knee hurts. I'm in pain.
Common symptoms: headache, stomach ache, sore throat, cough, runny nose, fever.
Nausea, dizziness, fatigue, chills, body aches, shortness of breath.
Nausea means feeling like you need to vomit. Fatigue means extreme tiredness.
Chills means feeling very cold and shaking. Shortness of breath means difficulty breathing.
I have a fever. I'm coughing a lot. I feel dizzy.
My nose is running. I feel nauseous. I'm exhausted.
Common illnesses:
Cold, flu, infection, allergy, food poisoning, migraine.
cold, runny nose, sneezing, flu, fever, body aches. Worse than a cold.
Infection, when bacteria or virus causes problems. Allergy, a reaction to something like pollen or food.
I think I have a cold. I might have the flu. I have a sinus infection.
These are the basics everyone needs to know.
Now let's learn what happens at the doctor's office.
First, making an appointment.
I'd like to make an appointment, please. I need to see a doctor.
What's the reason for your visit? Are you a new patient or existing patient?
I have a bad cough. I'm a new patient. I'm an existing patient.
What's your name and date of birth? Do you have insurance? What's your insurance provider?
In the US, you need health insurance. Always know your insurance company name.
What happens when you arrive at the clinic?
You check in at the front desk. Please sign in. Fill out this form.
Please have a seat in the waiting room. The doctor will see you shortly.
Important people at the clinic.
Doctor, physician, nurse, receptionist, medical assistant.
Physician is a formal word for doctor. Medical assistant helps the doctor.
Specialists: dentist, dermatologist, cardiologist, pediatrician, surgeon.
Dentist, teeth. Dermatologist, skin. Cardiologist, heart.
Pediatrician, children's doctor. Surgeon does operations.
In the exam room, the doctor asks questions.
What brings you in today? What are your symptoms? When did this start?
I have a sore throat. It started 3 days ago. The pain is getting worse.
On a scale of 1 to 10, how bad is the pain? Have you taken any medication?
About a 7. I took some aspirin, but it didn't help.
I'm going to check your vital signs. Open your mouth and say, ah.
Vital signs means blood pressure, temperature, heart rate, breathing rate.
Take a deep breath. Does this hurt when I press here? Follow my finger with your eyes.
Always be honest with your doctor. Tell them everything.
Sometimes the doctor needs to run tests. Let's learn that vocabulary.
Common medical tests.
Blood test, urine test, X-ray, MRI, CT scan, ultrasound.
Blood test. They take a small amount of blood. X-ray takes pictures of bones.
MRI and CT scan take detailed pictures inside your body. Ultrasound uses sound waves.
We need to do a blood test. I'm ordering an X-ray. You'll need an MRI.
What does the doctor say about tests?
As doctor, we need to rule out infection. I want to check for, just to be safe, let's do
Rule out means make sure you don't have something.
common procedures and treatments.
Injection, shot, vaccination, prescription, medication, treatment.
Injection or shot, medicine through a needle. Vaccination prevents diseases.
Prescription is written permission to get medicine. Medication is the medicine itself.
You need antibiotics. I'm prescribing pain medication. Get this prescription filled.
What about instructions from the doctor?
Take this medication twice a day. Come back in 1 week for a follow-up.
Rest and drink plenty of fluids. Avoid heavy exercise. Apply ice to the area.
Take with food. Don't take on an empty stomach. Finish the entire prescription.
Very important. Always finish antibiotics, even if you feel better.
Follow your doctor's instructions exactly. Now let's go to the pharmacy. This is where you get your medicine.
In American English, we say pharmacy or drugstore.
The person who gives you medicine is the pharmacist.
I need to fill this prescription, please. I'm picking up a prescription.
What's your name and date of birth? It'll be ready in about 15 minutes.
How do I take this? Are there any side effects? Can I take this with other medications?
Side effects are negative reactions to medicine.
Take 1 pill twice daily. Take with food. May cause drowsiness.
Adding warnings. Don't drink alcohol with this medication. Don't drive while taking this.
Types of medicine.
Pill, tablet, capsule, liquid medicine, syrup, cream, ointment, drops.
Pill and tablet are solid medicine you swallow. Capsule has medicine inside a shell.
Cream and ointment go on your skin. Drops go in eyes or ears.
Continuing. Over-the-counter versus prescription.
Over-the-counter, OTC, you can buy without a prescription, like aspirin, cough syrup.
Prescription medication needs doctor's approval, like antibiotics, strong pain medication.
Do you have anything for a headache? I need cold medicine. Do you sell pain relievers?
Aisle 3 has pain relievers. Try this cough syrup. This is a generic version. It's cheaper.
Generic means same medicine, different brand, lower price.
Now, let's talk about emergencies. This is critical vocabulary.
When to go to emergency room, ER.
Severe chest pain, difficulty breathing, heavy bleeding, broken bones, severe burns.
Loss of consciousness, severe allergic reaction, poisoning, major injuries.
Call 911. I need an ambulance. It's an emergency.
What's your emergency? What's your location? Stay calm. Help is on the way.
In the U.S., 911 is for police, fire, and medical emergencies.
Ambulance takes you to hospital. Paramedics provide emergency care.
What about less serious situations?
Urgent care is for things that need attention soon but aren't life-threatening.
Minor cuts needing stitches, sprained ankle, bad cold, ear infection.
I think I need stitches. I sprained my ankle. This cut won't stop bleeding.
Emergency vocabulary everyone should know.
Allergic reaction, anaphylaxis, heart attack, stroke, seizure, unconscious.
Anaphylaxis, severe life-threatening allergy. Unconscious means not awake, not responsive.
Stroke, blood flow to brain blocked. Seizure, uncontrolled shaking.
He's having a heart attack. She's having an allergic reaction. Call 911 immediately.
At the ER, they ask, what happened? When did this occur? Are you allergic to any medications? I fell and hit my head. About 30 minutes ago? I'm allergic to penicillin.
Are you taking any medications? Do you have any medical conditions? Who's your emergency contact?
Always know your allergies, medications, and emergency contact person.
Write this information down. Keep it in your wallet or phone.
Body parts vocabulary for emergencies. Head, neck, chest, abdomen, back, arm, leg, hand, foot.
Wrist, ankle, knee, elbow, shoulder, hip.
My chest hurts. I injured my ankle. I can't move my arm.
Be specific. Left arm or right knee. This helps doctors.
We covered so much important health vocabulary today.
This isn't just learning English. This is about your safety.
We learned symptoms, doctor visits, medical tests, pharmacy terms, and emergency vocabulary.
From I have a headache to call 911.
Your homework? Make a medical information card.
Write down your allergies, current medications, emergency contact.
Add your blood type if you know it. Keep this card in your wallet.
Also, learn how to say your most common health issues in English.
Practice saying, I'm diabetic, or I have asthma, or I'm allergic to.
In an emergency, you might be stressed. Practice now so it comes naturally.
Don't be embarrassed about your English when you're sick.
Healthcare workers are trained to help people from all backgrounds.
Thank you for learning this important vocabulary with us.
Share this episode with friends and family. Everyone needs to know this.
And subscribe. Next week, we'll talk about travel and transportation vocabulary.
Perfect for your next adventure.
Until then, take care of your health.
And remember, your health comes first.
Don't hesitate to seek medical help if you need it.
You're important.
Stay healthy, stay safe.
Waving caringly. See you next week.
Take care of yourselves. Goodbye.